two girls look totally different but were born to the same mother only 1 minute apart. Though this was almost unheard of 20 years ago, there have been quite a few documented cases recently. These two beautiful little girls demonstrate so well how two different children created and grown together can turn out to be with the power of genetics. Usually, people with dark skin hold more dominant genes than people with light skin. This makes this occurrence even more curious. 13. Cone head deformity caused by Agent Orange. Agent Orange is a chemical weapon that was used by the military in the past. Most of the cases of enemy exposure occurred during the Vietnam War. The effects to children are drastic deformities that are not reversible. The child in this picture was 5 years old. The cosmetic changes appear drastic, but his intelligence and emotional levels were not as drastically altered. Unfortunately, many children were changed forever by Agent Orange. This is why it was recently banned for use by the United States military. 12. Child with vitiligo. Vitiligo is a skin condition that causes the loss of pigmentation in certain parts of the body. Doctors have been unable to pinpoint exactly what causes it. Research has found that it can be caused by chemical contact, autoimmune diseases, oxidative stress, and genetics. This adorable baby has vitiligo on over 50% of his face. Some people with vitiligo will attempt to even their skin tone to one color with skin bleaching, but this is of course not recommended for children. 11. Child with extreme cleft palate. The cleft palate is also a common deformity, and usually it is easily fixable with cosmetic surgery. This child, however, has a growth protruding from his nasal cavity. This will seriously inhibit the possibility of cosmetic surgery. Removing the growth and fixing the cleft palate would enable better breathing for the child, but he may never be able to qualify for the surgery. 10. Child with hypertrichosis. Hypertrichosis is a condition that causes hair growth over the entire body. It is a genetic condition and is often called werewolf syndrome. This rare condition does not have many treatment options, especially for children. Oftentimes, whole families will have hypertrichosis. This is better because children with conditions like these can suffer extreme bullying by their peers, causing emotional damage. 9. Child born without a sternum. The sternum is better known as the breastbone. This child was born without a sternum, causing difficulty breathing. This condition is extremely rare and will cause lifelong problems with breathing, digestion, and growth of the torso. When this child is older, it may qualify for the insertion of a prosthetic sternum if it lives to be old enough for the surgery. Children with abnormalities like this have a high chance of SIDS and sometimes do not make it past the first year. 8. Conjoined twins who survived separation and prospered. These twins were born conjoined at the stomach. They were great candidates for separation because all of their major organs were separate. The twins were successfully separated and were able to function as any normal children would once they were fully healed. With improving medical technology, the chances of success after separation are high, depending on the extent of the organs shared by the twins. These two were very lucky and only really shared skin and nerves. This made their separation much simpler than most. 7. Child with hydrocephalus. Hydrocephalus is caused by an overproduction of spinal fluid that builds up, causing the skull to stretch. This gives the skull a bulbous and veiny appearance. This condition is usually congenital, but is sometimes acquired later in life by environmental factors. 6. Boy with elephantitis of the legs. Elephantitis is the swelling of body parts caused by inflammation. This may be caused by environmental issues, genetics, or trauma. In this boy's case, he contracted it from a flesh-eating bacteria. He is bound to his bed and cannot wear typical clothes because his legs are too wide. He is a 10-year-old from Uganda. 5. Boy born with extra limbs. This young boy was born with a set of legs and 2 small arms growing out of his stomach. Cases like these almost always result from the presence of a parasitic twin. The more dominant twin will absorb the other in the womb. In some cases, the twin is only partially absorbed. 4. Little girls with microcephaly. Microcephaly is the occurrence of a smaller than normal head. This condition occurs when the baby's brain does not develop properly in the womb. Sometimes it occurs on its own, and sometimes it is accompanied by other birth defects. In the case of these two little girls, microcephaly was caused by the Zika virus, which is contracted by certain types of mosquitoes. 3. Baby